Why is miliary TB sometimes hard to treat with drugs? Imagine a tiny army of bacteria spreading through your bloodstream, invading multiple organs at once. That's what happens in miliary tuberculosis, a form of TB where the bacteria travel far and wide, creating countless small lesions called miliary nodules. Because these bacteria are everywhere, it's like trying to hit a moving target in many different places. Some organs are harder for drugs to reach, especially those with poor blood flow or protective barriers, making it tough for medicines to fully eradicate the infection. Another challenge is drug resistance. Some strains of the bacteria have evolved to resist the usual medicines used to treat TB. These are called multi-drug resistant or extensively drug-resistant strains. When bacteria resist standard drugs, doctors need to use longer, more complicated, and often more toxic treatment plans. Detecting these resistant strains takes specialized laboratory tests, which can take weeks to get results. During this waiting period, the infection can worsen or spread further, increasing the risk of treatment failure or death. Diagnosing miliary TB is also tricky. Its symptoms are often vague and can resemble other illnesses, like pneumonia or other infections. Chest X-rays might not show clear signs early on, and confirming the diagnosis often requires advanced imaging like high-resolution CT scans or tissue biopsies. Plus, testing for drug resistance can take additional time. All these delays mean that treatment might not start as quickly as needed, which can reduce the chances of a successful outcome. Treating miliary TB is complex because it involves using multiple antibiotics over a long period, sometimes up to a year or more. These drugs can cause side effects, especially to the liver, and patients with other health issues like HIV may face additional complications. The side effects and the long duration can make it hard for patients to stick with the treatment plan, leading to missed doses or stopping treatment early. When treatment isn't completed properly, the bacteria can survive and become even more resistant. Finally, many factors outside the disease itself can make treatment harder. Limited access to health care, financial difficulties, and social challenges can prevent patients from getting the full course of treatment or attending regular checkups. In resource-limited settings, these barriers are even more significant. Because miliary TB requires careful, prolonged management, any interruption can lead to poor outcomes. In summary, miliary tuberculosis is difficult to treat because it spreads widely through the body, often involves drug-resistant bacteria, faces diagnostic delays, requires complex and potentially toxic treatment, and is influenced by patient and healthcare system factors. Early diagnosis, proper drug susceptibility testing, and tailored treatment plans are essential for improving outcomes. If you or someone you know is dealing with TB, it's always best to consult healthcare professionals for personalized care and guidance.